Hello everyone, my name is Hiroyuki Odagiri. I belong to the Department of Clinical Epidemiology and Health Economics of the University of Tokyo. Also, I work at Saiseikai Kawaguchi General Hospital as a gastroenterologist. It is my pleasure to introduce my manuscript entitled Hospital Volume and Adverse Events Following Esophageal Endoscopic Submucosal Dissection in Japan by using a personal video statement in endoscopy. Because of its minimally invasive nature, esophageal endoscopic submucosal dissection (ESD) has gradually acquired popularity worldwide. However, complication rates following esophageal ESD are poorly understood in a nationwide clinical setting, because most reported complication rates following esophageal ESD have been based on a limited number of procedures conducted in some specialized centers. Additionally, associations between hospital volume and complication rates following esophageal ESD have not been clarified. In the present study, we use the Japanese Diagnosis Procedure Combination Database to examine the current status of esophageal ESD. This database is one of the large healthcare databases in Japan and covers more than 50% of patients in acute care hospitals in Japan. We identified 12,899 esophageal ESD procedures at 699 centers. Among these patients, perforation occurred in 422 patients. With regard to the association between hospital volume and complication rates following esophageal ESD, there was a linear association between a lower hospital volume and a higher rate of adverse events following esophageal ESD. The database lacks some information on clinical pathological findings regarding ESD. Further studies are needed to refine risk factors contributing to higher rate of adverse events among low-volume hospitals. I thank my co-authors, in particular Professor Hideo Yasunaga. Thank you for your attention.